My name is Dr. Lorne Zinman, and I'm a staff neurologist here at Sunnybrook Health Sciences Centre at the University of Toronto. I'm also head of the Sunnybrook ALS Clinic. Sunnybrook houses one of the largest ALS clinics in North America. We see approximately 250 new diagnoses of ALS annually and have over 1,000 clinic visits. The ALS clinic at Sunnybrook is really an outstanding multidisciplinary clinic because of our team. It's not just neurologists, we also have respirologists, physiatrists, nurse coordinators, occupational therapists, speech-language pathologists, dietitians, as well as our research coordinators taking part in the clinic. That's essential because research is embedded in clinical care, given the importance of finding new treatments for this devastating disease. ALS is a very complicated disease, and we still don't know why people get this disease in the majority of cases. The ALS research community understands that in order to make major gains, we have to work as a team and form collaborations in order to find new treatments. In Canada, we came together and formed something called the Canadian ALS Network, or CALS. And what it is, it's a collaborative network of ALS clinics across Canada. All 15 ALS clinics in Canada are represented in CALS, and our main mission is to find new treatments and improve the quality of life for patients with ALS. Our primary focus is bringing clinical trials to Canada, and we do this with both in collaboration with industry and research networks in the United States, in addition to starting our own clinical trials. We also collaborate closely with our basic scientists who bring to us the most promising medications that we can test in patients. Presently, CALS Network is participating in 2 clinical trials. They're testing 2 drugs that we think can improve the lives of patients with ALS. One drug promotes nerve outgrowth, and the other drug makes muscles stronger. In order to determine if a drug is effective in ALS, we have to do a clinical trial testing it against a placebo, so we're sure that the drug is effective. If the drug does show efficacy, the next step would either to do a larger clinical trial, or if a significant enough effect is seen, we can go right to Health Canada to try to get approval of this medication. We're hoping that these 2 medications will have a positive effect in patients with ALS and ultimately can be used in clinics worldwide. In addition to clinical trials, ALS Canada has supported other research studies that I've taken part in. We received a Bernice Ramsey grant to look at specifically at the most subtle speech and swallowing changes that occur in ALS. We've also received funding from ALS Canada to look at imaging changes that occur in the brains of patients with ALS. Something very important that we notice in our patients is the economic burden of this disease. And ALS Canada funded a study to actually determine what the out-of-pocket expenses are for patients with ALS. And we weren't surprised to see that they are substantial. Based on this study showing considerable out-of-pocket expenses for patients with ALS, we're hoping to lobby additional support from government to improve the lives of patients with this costly disease.
We have a peer support group that's been running for about 5 or 6 years now, and it was started by a patient who was a psychotherapist and a minister with the Anglican Church, and he said that there was no venue available for just persons with the disease to share their feelings.
ALS is a rare neurological disease, and it's difficult to raise funds for research studies. We are very fortunate in Canada to have the ALS Society of Canada to support research initiatives and to also support patient care. ALS Canada could not function without the generous donations of families and friends of clients with ALS, and this is especially important during the walks where the majority of the funds are raised.
Maybe you're here walking for a friend, a family member, a loved one, or you're here this morning because you have ALS. It's hard to fundraise, but you do it, and you do it for the people that you love and care about.
We are greatly appreciative for any support we receive, and we hope together we will find better treatments for this devastating disease.